stuff. Okay, next we're moving to Dr. Catherine Berens from DG Research and Innovation at the European Commission. Good morning to you. Thank you.
Good morning, and I would like to thank the organizers for having me invited to this very interesting event today. I will give you maybe a different viewpoint from a funding agency perspective on international collaboration, and I would like to highlight a few of our initiatives, how we foster such international cooperation. With the huge burden of brain disorders, which requires multidisciplinary approaches to better understand such disorders, to rapidly deliver solutions for rapid implementation, but also the need to support long-term research to better understand this interplay, the complex interplay between genetic, environmental, and lifestyle factors. The European Commission has had a long-standing commitment to support research into the brain. And here I have put the figures from our previous framework program for research, which has supported this research at an unprecedented level of €3 billion of collaborative research support to the careers of young researchers and also blue sky research from the European Research Council. And this from basic researchers to understand the processes and the functions of the brain, but also translational and clinical research on neurological diseases, neurodegenerative diseases, psychiatric disorders, and also public health research. A core of this funding went to collaborative research, which has an international dimension in Europe, but also outside Europe. And as you see on this slide, there were many connections created over the 7th framework program for research. And here you see a typical collaborative project in the brain area that we funded over the years in FP7. An average of 13 participating institutions, but more than 80 people collaborating in each project, and very efficient projects delivering many high-impact publications, filing for patents, but also creating small and medium-sized enterprises. This approach we have kept in Horizon 2020, the framework program for research and innovation that is currently ongoing. And we have a number of different approaches to international collaboration. The one I just explained with collaborative projects, public-private partnership with the European Federation of Pharmaceutical Industries and Associations, but also public-public partnerships together with member states and their national programs for research, public-public partnerships with other international funders, and as well as the Human Brain Project, the ICT infrastructure that we heard about already from Professor Markham. Collaborative research in brain is mainly funded from our societal challenge, health, demographic change, and well-being. And this societal challenge is meant to translate science to benefit citizens, meaning fostering an active and healthy aging, to develop and test new healthcare models and approaches, to have better health outcomes, and to support a competitive healthcare industry. And this departs from the disease-oriented that we were focusing upon in the previous framework program for research. So now we don't focus anymore on the diseases. It is left up to the researchers to decide on which disease they want to work. And this allows to better depict the biological variations and also work to analyze the comorbidities, for instance, which is very important. So it provides basically more opportunities for brain research. And the first Horizon 2020 collaborative projects are already worth more than 400 million euro, from basic to clinical, ICT, and also coordination of member states' activities in the first calls. I mentioned our public-private partnership with the pharmaceutical industry, which is extremely successful. And it puts together industries with academia, clinicians, patients, when necessary, regulators and payers, to try and address those hurdles, preventing a rapid delivery of new therapies on the market. In the previous phase of EMI, there were many projects supported in the brain area with more than 140 million euro allocated to such research, addressing, for instance, Alzheimer's, schizophrenia, amongst others. And we are now in the second phase of this public-private partnership, which has developed their strategic research agenda according to the WHO priority medicines for Europe and the world report. And in this strategic research agenda, neurodegenerative and psychiatric disorders are very high. So we have already a commitment from the European Commission of 75 million euro allocated to a number of various topics, putting industry together with academia under EMI. Very important in our opinion is that we coordinate in an appropriate way the scarce resources that we have, not only at European level, but also at EU member states level. So everybody in Europe is conducting research in the brain area, and there are a number of programs ongoing. So we thought it would be good if the member states sit together and try and align their priorities, which is what is being done in two main activities: the Joint Programming Initiative on Neurodegenerative Research, maybe you have heard the acronym, which is JPND. It gathers now 30 countries, European countries, but also reaches to third countries outside Europe. We have Canada, Switzerland, and also Australia, who recently joined. And it is a mean to increase the coordinated investment of these programs. And the European Commission is also now co-funding the transnational calls which are being issued under the JPND. It has a strategic research agenda spanning biomedical, healthcare, and social sciences research. And it has conducted a mapping of the brain resources which are available in Europe around neurodegeneration. So this is now publicly available in a public database that can be consulted. And very importantly, the strategic priorities which have been identified have also informed the development of national research plans and strategies. In the area of neuroscience, neurology, and psychiatry, we do have a similar initiative, which is Neuron 2, the Network of European Funding for Neuroscience Research, with a strategic research agenda addressing the disease mechanisms, the progression, the prevention, and the treatment of these diseases. And they have already issued common calls, transnational joint calls, for more than 70 million euro. And currently there is an open call, which is co-funded by the European Commission around traumatic brain injury and spinal cord injury. On the international scene, it has been reflected over the last decade to try and join forces to address common global challenges. And biomedical international research agencies have done so in a number of areas of common interest, in order to radically transform the way research is being performed in these areas, and also to accelerate advances in the areas. And I would like to mention two of these initiatives which are directly relevant to brain research. One is the International Initiative for Traumatic Brain Injury Research, and the second one is the Global Alliance for Chronic Diseases. I will give you just a few highlights of the INBIR, as Professor Menon will speak just after me to give you the details. But it was created because we realized that the burden of traumatic brain injury is increasing. We have a number of very different patient populations, varied clinical clinical interventions, which overall lead to very diverse patient outcomes. So it's very difficult to reach a really critical mass for delivering proper results and meaningful and impactful results. Therefore, together with the NIH, the Canadian CIHR, and recently the not-for-profit organization One Mind, we reflected that sharing data and collaborating on an international scale would allow to support the development of a better classification of these traumatic brain injuries, based not only on the clinical symptoms, but also on the molecular level factors. To have better and to discover better diagnostics and prognostics biomarkers, also to standardize the outcome assessment of all those traumatic brain injury, to ultimately allow for comparative effectiveness and identify those best clinical practices that could then be applied globally. The second such flexible, very flexible cooperation between international funding agencies is the Global Alliance for Chronic Disorders. And this one is really focusing on implementation research in order to try and translate those healthcare interventions which have been demonstrated as effective to have them really work in different settings, geographical different settings, and taking also into account the different populations addressed and the socio-economic context. And it is really focusing on those vulnerable populations in low and middle-income countries, but not only also vulnerable populations in high-income countries. So it is meant to fill the gap between what we know and how we can really apply it so that it has a concrete outcome for the citizens and the patients in real settings. Scaling up activities are also very important in the JSCD to make sure that it reaches many people at regional and national level. And why I am mentioning this particular one is because as funders, we think that the next call that we will issue should be around mental health, fostering mental health, and preventing and managing mental disorders, including dementia. I will not enter into the details of the Human Brain Project, which we heard about from Professor Markham previously. It's really aimed at developing these ICT platforms to deliver on neuroscience, medicine, and computing modeling. And I think it's really a very important project in terms of open science and where international collaboration is really key. So I'm very happy that now the platforms have been released in the public domain, and I am even more happy to have heard Professor Markham inviting all the international initiatives to bring their data for analysis to contribute to this modeling exercise. And we really think on the Commission side that it would have a very much bigger impact globally if all these international brain initiatives could sit down together and try and find synergies and complementarities. So to sum up, we are offering really a good network of collaborative research projects. We have an efficient public-private partnership ongoing to accelerate the delivery of innovative therapies. We have an established framework of research coordination between EU countries, international cooperation, global cooperation we have a strong experience in, and now an ambitious ICT infrastructure available for neuroscience research. So there are a lot of collaborations and data sharing, knowledge sharing opportunities within our program. In order to accelerate innovative research, we support very much the development of careers for neuroscientists and brain researchers, and we give strong support to international cooperation efforts. Thank you very much.